Right, hey everyone, I'm Chloe, one of the physiotherapists here at Vector Health, and I'm here to talk to you today about our new antenatal exercise programs. Yay! And today I'll just be giving you some rundown on what we're actually doing in the class, from exercises to the reasoning why, and a little bit about pregnancy and your antenatal changes throughout your pregnancy. So let's just start with what happens to our body when we are pregnant. What musculoskeletal changes do we get throughout our pregnancy? So there are a few common changes that you may know, but I'm here to tell you those ones that you don't. So let's bring out our nifty spine. So when you're pregnant, with the increased weight that you get from the front, from your belly and from Bubba, you do start to change this curvature of your spine. So this is a generally normal spine. So when we are pregnant, we start to get an increase, or we call a lordosis, in the lower part of our lumbar spine. So as baby gets bigger, as you grow, you start to move that forward there, and you start to compensate for bub. And with that also, you get an anterior pelvic tilt. So that means that this is our pelvis. Anterior means forward, so your pelvis starts to dip forward. And that kind of makes sense because as our pelvis tips forward, we get a curve in our back to try and keep nice and straight, and then our spine starts to curve a little bit more. So that actually puts a lot of pressure down in our back and our hips as well. Alright, another change with pregnancy is that you get increased laxity within your joints. So all those lovely hormones start raging through your body, starting to prepare you for birth. So with that, the laxity means loosening of the ligaments. So you have ligaments at the front here in your pelvis, you have ligaments through the back. So with that, your pelvis starts widening. So from here, it starts widening this way, and you can get discomforts through the front, which is your pubic symphysis. People might know it as lightning crotch if they get pain there, or you start to get pain through the back. So with these general physiological changes that do happen within the body, we have to change and exercise in a safe way. So we have to specifically alter and individualize each exercise to accommodate all these changes. And that's where we come in handy, and that's why we have created this program to allow new mums to be able to exercise in this safe way. So with the specific exercises and program progressions that we do make over the course of the 6 weeks, we always just keep in mind that the exercises are to decrease the discomforts that come with pregnancy. It can also help with labour, which I'll talk about later on in a future post, and it also assists with your postpartum recovery.